Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning. I'm Dr. Kim Allen Williams, chair of medicine here at the University of Louisville, and it's my pleasure to introduce our grand round speaker for today. It's Dr. Joshua D. Sparks, who is an associate professor in pediatrics in the Division of Pediatric Cardiology here at University of Louisville. He spoke to us today about let's talk about rare disease diagnoses, doctor to doctor. Dr. Sparks, can you give us a 1-minute summary of your talk?
Sure. I appreciate the invitation to come and speak with everyone today. As a pediatrician, I don't get to do that very often with medicine folks. My talk's a little atypical. It's about really my experience. About 5 years ago, I was diagnosed with a very rare disease after a 10-year length of misdiagnoses, essentially. And in that process, I have learned a lot, I feel, about what it's like to be a patient. And some things that I've learned that physicians can do to help patients get out of stuck misdiagnosis circles with rare diseases, as well as they can do things they can do for patients in general to help support them as they work through challenging diagnoses and diseases. And a little bit kind of sharing my experience as a physician patient. And so,
really appreciate your insights and your willingness to share the story to benefit us all. What is it like to cross over to the other side?
Yeah.
Really appreciate it.
No, it's my pleasure. Thank you so much for the invitation.
And this has been a Cardinal Minute.